Well, thank you all for joining me today. This is quite an honor to get a chance to talk with as many bright people as I have, and I am today. And I just want to say that I am incredibly proud of you all in the medical school. I think it's one of the great achievements of the Cleveland Clinic. And as you probably may have heard rumors already, when you graduate, that is if you graduate, I'll write you a little note and offer you a job at the Cleveland Clinic when you finish your training and your residency. We think you're terrific. We want you to come back. You're our investment in our future. So I'm thrilled to be here and ready to talk about anything you guys want to talk about.
Sounds good.
Thank you.
Dr. COSGROVE, thank you for being here.
Everybody calls me Toby, so that's probably be okay.
So I think I speak for all of us when I say how thankful we are to be part of the Cleveland Clinic in an amazing program like this. My name is Daniel, and I'm from Columbus, Ohio. And
my name is Lillian. I'm from Solon, Ohio, so from around here.
I'm Lauren, and I grew up in the Cleveland area, also in East Flood.
And who are you?
I'm that guy that you drug up from Houston.
So Dr. COSGROVE, you've made a tremendous commitment to medical education. What made you so passionate about this subject and to even offer us all full tuition scholarships?
Okay, well, you all have made a sacrifice in coming here in the fact that you decided that you wanted to go to medical school for 5 years. I personally couldn't imagine doing that myself, but if you were that interested and willing to come and really prepare yourself for an academic career, I wanted to be supportive, and I realized that about 6 or 8 years ago, we realized that the average medical student graduates with $180,000 worth of debt. And should boy meet girl medical students, that could multiply. Other things could multiply too, but
That does happen on occasion.
And so what we said was, well, look, if they're willing to make that sort of sacrifice, then I think that we need to do something that'll assure that they follow through on that commitment. And so I hope that someday that we'll see as many of you back at the Cleveland Clinic, having great careers as in the field of academic medical center. So that's the reason we did it.
Thank you.
So our program is expanding to have more interaction with or more interprofessional connections. So can you tell us a little bit more about your decision to partner with Case Western Reserve University in creating the Health Education Campus?
Yeah. So this goes back, probably 5 years ago. The Case Medical Student School realized that they had to, in order for their accreditation, they had to come up with a new physical building. And at the time of their last accreditation, the one thing they were cited on was their physical facilities. So they were in the process of thinking about building a new building. And at the time, and I think you were there, and I was sitting, I think, with my feet on the desk. Yeah.
Propped up. Let me set the stage here. I was in the room. Our chief philanthropic officer was in the room, and Toby was in his office, which was down on the first floor. And Toby, if you haven't noticed, has a few little quirks, not just a few. And his office is very pristine. Toby's a minimalist, if you were going to characterize music that he would write or art that he would have on the walls. He likes a pale color on the walls, and traditionally...
They know about my book?
You've noticed. Traditionally...
My book, have you read my book? 50 Shades of White?
Yeah, I forgot that one. But traditionally, I mean, ever since the very first time I was in Toby's office, when he was a heart surgeon and we were working together on many things, he had a bowl of pencils in the middle of his desk. And he would intermittently pick the pencil out. He didn't always use them, but he would use them, and he would twirl them, and he would, I don't think I ever saw you chew one, but I knew never to pick a pencil out of that bowl. And so Toby had picked a pencil out of his bowl, rocked back in his chair, put his feet up on the desk, put his hands behind his head, as he is noted to do in these kinds of conversations. And as we were talking about Case, as we were talking about us, as we were talking about you, he had a plot of land that was out west of here that he originally had thought would be a great place to stick the medical students and us. And we were talking about what Case was doing, et cetera, and then Toby came up with the concept and the idea. So I'll pitch it back to you, Toby.
Yeah, so we were sitting there, and I said, well, why don't we use what the theater is down west of here? And I said, it looks pretty academic. It's got columns and red brick. And
You said it had ivy on the walls, Toby. That's what you said.
And so I thought that that would be a location for the medical schools. So I said, gee, well, maybe we put both medical schools there. And so I went to over to see Barbara Snyder, and I said, I've got an idea. And I said, why don't we put the two medical schools together in the same physical space? And she said, let me think about it, and called me back a couple days later and said, fine. So then we were looking, and I said, here's the space I got to look at. And she said, well, it looks like it's too far away from the campus. So then we looked at another building that we were jointly owned, the Walker Building, which is close to their campus, which was jointly owned and operated with University Hospital. And I tried to buy University Hospital out of that facility, and they said no, they didn't want to. And so we have a model of the campus built up down on the first floor of the Miller Building. So Barbara Snyder and I were walking around this one day, and she said, what about right here? And I said, done. And that's where they're building the new building. Now, it went on a little further than that. She said, well, we have to have space ultimately for the dental school and the nursing school and the PA school. And I said, Barbara, we could save that space, but why don't we do it all at once? And because healthcare is a team sport, and, instead of teaching people in silos, let's introduce people to the team that they're going to work with for the rest of their existence. And she said, great. So we'll have 4 buildings there. And I said, well, why don't we do it sort of like the quad at Oxford or Cambridge, with, 4 corners and a big grassy thing in the middle. And then a few days later, I thought, the weather's so crappy here that'll never get used. It would be too hot or raining or snowing or something. So that's when we decided to cover it. So that's how it came to pass. And so we're in the process of obviously building it. It's going to be a sensational facility, but the concept to me is not just a new building. The concept is a new concept in education. It's team play and learning together, and it's also using the technologies that are currently available. And you all heard about and seen what we're doing with both Watson and with Microsoft, but there's a hell of a lot of other new technology. I mean, erasers and chalk are sort of ought to be a little passé by now. So that's what the idea is, and I met with her just this morning to press the professors to begin to have, and I'll press you right now on this, to begin to think about not having to teach biochemistry and anatomy and physiology to one group and then another group and another group. Let's learn together. And let's get away from paper and file cabinets, and let's go electronic. And that's the way the building is set up, and that's thought process behind it. That was a very long answer for a very short question.
So another very innovative building that you've been a part of developing is the Global Center for Health Innovation, in which the Medical Innovation Summit is held. It's been open for 4 years now. So 4 years later, how has this complex changed Cleveland, and has it fulfilled the vision that you had for it?
So let me tell you about the vision. What I thought was, when I sort of came on the scene, I was really concerned about Cleveland from a economic standpoint. And as you know, Cleveland's currently the poorest city in the United States. And I didn't think that we were going to be able to change that without providing jobs and improving the quality of employment and people coming to the city and so on. And a lot of people in the United States has been thinking about biotech. You know, everybody says, oh, biotech, you know. Well, biotech depends upon universities turning out gallons and gallons of PhDs coming out of graduate schools. And we just don't have that here. So, and everybody else in every other city had done biotech around the country, and we're sort of late to the party thinking about that. You go to all these meetings, and everybody trucks in all their stuff, and then they rip it all down and they truck it to the next meeting, and there's no place that you can go and see all the gear that goes into a hospital. So I said, why don't we try and do something here? And so when I first became CEO, I went and I contacted the Kennedy family, who have the Merchandise Mart in Chicago. Now, I knew the Merchandise Mart from Chicago because my wife redone our house on a couple of occasions, and she lived there. They have everything from carpets to chandeliers. It's a full city block in Chicago that has everything you can imagine goes in the house. Curtains and faucets and beds and furniture and artwork, and you name it's in there. And there's been a little industry that's growing up all around that. So I said, you know, gosh, we could do that same sort of thing here in Cleveland. And people would come to Cleveland to see what's going on there. Well, I pitched the idea, and that's the last I heard of the idea from anybody for about 5 years. And then that kind of took off, and they started to build it. And initially I thought we'd put it down where the Playhouse area is, next to the Cleveland Clinic. And the people from the Kennedy's group decided that that ought to go downtown and ought to be associated with a major convention center. So then subsequently, so they built that, built the convention center, built the hotel that goes with it, terrific facilities. And then we had to figure out that then people finally realized they had to put something in the building. And it kind of migrated, frankly, towards IT. I can't tell you how important I think leadership is. And it is, you know, people watch a leader every minute. I mean, there's some funny stuff that's happened to me as being a leader. I mean, I was preaching wellness. I happened to go to a basketball game and eat a hot dog. They, you know, the next thing I'm all over the internet eating a hot dog. So, I mean, they watch everything they do. They watch, you know, whether I'm smiling, whether my hair's cut. I go to the supermarket on Saturday, and 4 people stop me. One wants a job, one wants to complain, one wants to thank me, you know, one wants an appointment. I mean, but I mean, so, you know, frankly, before I had this job, nobody knew who I was. I would go to a cocktail party here in Cleveland and be introduced as Anita COSGROVE's husband. And, you know, it all changed like that. So the place looks to a leader in ways that just are almost unfair, but it's true. And so they take, the organization takes the cue from the person who's leading. And it doesn't make any difference whether it's a nurse on a floor, the nurse on the floor's having trouble, all the patients are complaining, change the nursing leadership, changes like that. Unhappy department, change the leaders, things change like crazy. It's incredibly important, and it doesn't matter what you're talking about, study groups, football teams, you name it.
So,
I'm sorry, I rambled.
Dr. COSGROVE, keeping in mind with leadership and global health innovation, Cleveland Clinic now has hospitals in Abu Dhabi, London, Fort Lauderdale, and Las Vegas. And so how do you consider healthcare policies and culture from both a patient and provider perspective when implementing these programs?
Well, every place is a little different. I mean, Abu Dhabi, 80% of the people who walk in to see a doctor in Abu Dhabi speak Arabic. So, you know, and so clearly that changes the whole tenor of the interview. But I think you have to adapt to what the culture is, but nonetheless you have to keep the same basic cultures of the organization. And one of the things that we have insisted on is having doctor leadership from Cleveland in Abu Dhabi. We're going to do the same thing in London. The mistakes that we've made is when we haven't put our people there that take our DNA with them. And we've learned that, you know, you've got to have the Cleveland Clinic culture there to have that sort of success.
So in addition to being the CEO and president of Cleveland Clinic, you're also the only healthcare representative on the Strategic and Policy Forum for our president's administration. So I wanted to know, what was your motivation for joining the forum, and also what do you anticipate to fulfill in that role?
I'm glad I'm there. Frankly, I'm the only one representing healthcare, which is the largest industry in the United States. And I think it's a good thing for the Cleveland Clinic to be represented, and it's a good thing for healthcare.
Something that you stated in a recent interview is that instead of changing the Affordable Care Act in a major way, two ways that we can really reduce cost of healthcare is by looking at, first, how we treat the sick, and also, second, how we keep people from getting sick.
Did I say that?
Two markets. And I was just wondering if you could elaborate some ways that the Cleveland Clinic is doing this and addressing cost and wellness.
Yeah, well, so first of all, about 4 years ago, we realized what was coming down in terms of the fact that we were going to be paid less, and we really had to reduce the cost of our services. So we figured at that time that we would have to take about $1.5 billion out of our costs. And so we started, and this, by the way, was physician-led, and we've taken out about $900 million of costs to date, and probably got another 6 to go. And I think that that's going to be a constant process for us for the rest of your careers, and certainly for all of mine. And there's two reasons that we have to make healthcare affordable. First reason is that the nation can't afford the cost of healthcare, which is now 18 and projected to go to 20% of the GDP, and it's starting to eat into other things like education. And you stop and think. Right now, the biggest part of the budget in Ohio is Medicaid, and now it takes up 50% of the healthcare, 50% of the budget. And you're starting to see the cost of tuition at Ohio State going up as a result. So, and the other thing is that it's gotten to a point where on an individual basis, it's expensive. And it's now $10,000 per person in the United States, and some people bear more of the burden than others do. So, so we have to control the cost of healthcare, and it's going to be difficult for two reasons. One, we got more older people in the country, and there's more things we can do for them. You know, 30, 40 years ago, we didn't have artificial hearts, and we didn't have great cancer therapy, and we didn't have joint replacements, and et cetera, et cetera. So, and I think there's no question in my mind that things are going to continue to get more technologically advanced in what we can do. So, how are we going to do this? Well, to me, there's only two ways we can do it. We can improve the efficiency of how we deliver care to the sick, and we can keep people well. Now, so we've taken the costs out of our system. But we also are going to have to change how we deliver care. And we're going to have to keep people out of the hospital. We're going to have to figure out how we manage people practicing at the top of their license. We're going to have virtual visits, shared medical appointments. And on the other hand, we've got to do the same sort of thing that we did for our 90,000 dependents in our insurance. What we started out with was the smoking and the exercise and the food, and then we had disease management. And what's happened is our inflation rate has gone from 7.5% a year going up to 2% going down last year. So we bent that curve. It has been a 10-year process in learning, but if we don't start as a nation doing that sort of thing, we're never going to get there. I mean, think right now, 30% of the people in the United States are obese. Counting that, obesity counts for 10% of the healthcare costs in the United States. Smoking, 18% of the people in the United States smoke. You know, the most preventable cause of cancer. And I hope that there's then going to be a vacuum that we can come in and talk about what the root cause of the problem is, and that's the escalating cost of healthcare. And maybe we can get a bipartisan bill. It's kind of hard to vote against the fact that we want to make care more affordable. And there's a lot of things that the government can do, both legislatively and administratively, to fix this.
I'm curious how you approach trying to cut costs while at the same time not compromise the level of care, and what your perspective is on how you approach finding areas where you can cut costs.
Well, if you look at it, there's the administrative part of the cost of running a hospital, and there's the clinical. We took 20% out of the administrative costs, and we've taken about 10% out of the clinical costs. And we've taken the clinical cost out by decreasing the cost of purchasing, about just 1,000 different things that we have done to try and reduce those costs. It really has not affected, in fact, the quality of our health care has gone continuously up during that period of time. So I don't think we've affected negatively at all.
That's great, thank you.
So thank you so much, Dr. COSGROVE. One thing that continually strikes me as we move forward and we want to assume leadership positions is the challenge of having a unified vision for an organization or a group, but at the same time allowing people to use their skills and to flourish on their own to contribute to the mission. And I know some of us who may be considering leadership positions are trying to learn how to strike that balance. So I guess my question to you is, as we move forward, what are some of the things that we could reflect on to help us understand when and how to strike that balance of, you know, having a vision, but allowing those we're working with, if we're the leader in that group, to really express their own freedom in that setting?
Yeah, I think ultimately, let me tell you that I think a little bit is about leadership. And leadership, to me, means that you, the important thing for a leader is to have good ears and listen, have a vision, and then try to figure out how you bring people along to that vision. Leaders take people to places they don't know they want to go. Do you think this organization wanted to not hire smokers? Do you think this organization wanted to take sugar drinks out of? Do you think the No. Do you think the And by the way, the smoking rate right now is 5% with our employees instead of 18% in the general population, and the days lost from sickness has come down 28% over the last 8 years, and the weight of our employees hasn't gone up. So we got to, and if you stop and look at the things that have happened, there have been some things that weren't very popular, but when you stop and look at them in retrospect, you say, well, you know, maybe that worked. So I think you have to have a vision. You also have to listen to what people are telling you about, you know, why it should or shouldn't happen. And then you have to figure out how you communicate that and go forward. So let me give you an example of that. I thought it would be great to do random drug testing 13 years ago when I became CEO. I got so much pushback from so many different directions that I gave up. And then I turned around, 10 years later, and I said, we've now had about 5 people that I know of die in the Cleveland Clinic from overdose of drugs in the hospital. Not patients, employees. And I said, now I think it's time. And, we spent a lot of time communicating that message. And, right now, we're about the only hospital in the country that's doing this. And I'm so proud of us for doing it. You stop and think about the drug epidemic there are now. So let me tell you, I'm going to take this a little soapbox here. There are, during the Vietnam, anybody been to the Vietnam Wall? Yeah. You know how many names are on that? There are 53,000 people died in Vietnam. Last year in the United States, 53,000 people died of drug overdose. That's how serious the problem is.
How do you decide who has the characteristics and qualities that you look for to become a leader, clinical leader, for example, for Cleveland, London, and?
Well, first of all, I think everybody wants to know how you get promoted, which I think is the sort of the underlying thing. And I always tell people exactly the same thing. I said, you take a job and you exceed expectations of that job, and you work your tail off, and people do notice. It's surprising that they do. And, I was killing myself as a cardiac surgeon. I didn't think anybody noticed. They obviously must have noticed something because, I got an opportunity. So I think that's the first step. And I think that leaders have really got to have 2 things. They've got to be able to have a vision, and they have to communicate it. And the communication is endless. And communication, the written word isn't enough. You have to be able to talk to people. And I would say you can't practice that too much. One of the most embarrassing, difficult times that I ever did is I paid my way to go out to California to meet with media people and get a weekend of media coaching. Have you ever watched yourself on television? It's really humbling. Or if somebody comes along and sticks a microphone in your face and say, well, what do you think about world peace? These are, and so I think you really have to learn how to communicate verbally. That just writing is great if you want to be a professor, but if you want to lead people, you have to talk to them.
Hi, my name's Aaron McBride. I'm a third-year medical student. I was wondering if you found any really efficient ways or effective ways of communicating your vision or the positive culture all the way down to like PSR level or nurse level. It can be hard sometimes when someone just hears about a policy change or they're cutting jobs, and then everyone hears about just that part from the more disseminated ranks, and so they can get very upset. How do you keep that positive culture and help everyone catch the vision?
Yeah. So I think the most difficult thing to do is to get everybody on the same page. I do about 100 talks a year internally to every level of the organization. And generally half of it is news from me and half of it is Q&A. And then we do connections, we do staff meetings, we do newspapers, we do emails. So just to give you an example, the other day I'm walking across the bridge and so a woman stops me and says, Dr. COSGROVE, this is just about 6 weeks ago. She said, Dr. COSGROVE, I go across this bridge every day. Can you tell me what that new building is over there? The cancer building. I've been talking about it now for 3 years in every publication. So the point is you never can communicate enough. You never get the message out to everybody but you have to keep working and working and working, and there's 1,000 ways to do it, but none of it gets there. So what we've done is we've increasingly put the pressure on a sort of a cascading message that you have to take it down to the next level, and they have to take it down to the next level, and it has to go down to the next level till it gets right down to whoever it is. That is a difficult thing to do, and I don't think you can ever get to everybody. So the way I started out was my first talk that I gave. I handed out 40,000 buttons that said patients first. And it took about 5 years, I think, Jim, for that message to sink in to people. It was a long, hard communication process. We put it up on the wall, we had buttons, we had baseball caps, we did, everything you could think of. But eventually it gets there, but it is hard to change a culture, and it's hard to get the communication out with everybody. It takes a long time. There's no easy way to do it. And nobody hears anything I say until I've said it 6 times.
So there's a lot of injustice going on throughout the country and throughout the world, both within the healthcare system and just socially. And I was wondering, a lot of people look to like staples within the community to make statements. And I was just wondering how you decide to either make a statement on something or to just maintain a neutral, to maintain neutrality in the face of different injustices happening.
Okay, well, first of all, I don't do political statements. We stay strictly away from that for a number of reasons. First of all, 50% of the people are going to be elected. If I say something, are going to dislike it, and that's not good for the institution. So the only places we have stepped out of that are around education. We've said, we want to support tax increases for education, et cetera. And other than that, now, the important thing of that is that I recently talked with our Senator, Sherrod Brown, who didn't know whether I was a Republican or a Democrat. And if you look at the news, some people will say I'm a critic to the Affordable Care Act, and some say I'm a supporter. Perfect. I think that's just right, both of those. Now, as far as the social injustice is concerned, so let me talk about the social injustice relative to healthcare, because I think that's important. If you look at where we're going right now, we are in a difficult situation as caregivers because we have spent all our time looking at people who are sick. And the things that really determine chronic disease are the socioeconomic issues: education, food, housing, jobs, income. The income, for example, in the United States for women varies by income 10 years, and for males 15 years. And if you look right around the Cleveland Clinic, the life expectancy varies between here and the wealthy suburbs almost 20 years. Now, then if you look at where we are in the world compared with the other developed countries, we fall at the high end of what's spent on health care and at the low end on what's spent on social issues. I think, frankly, we're going to have a hard time. We're seeing right now the life expectancy in the United States last year went down for the first time. Our life expectancy in the United States is middle of the range of developed countries. I think the issues that we have to deal with are going to be those socioeconomic issues. And as healthcare providers and as doctors, A, we're not trained for that. B, we don't have the facilities. And C, we're not paid for it. So I think what we're going to have to figure out as a nation, what are we going to do about this if we want to decrease the cost of health care and improve the quality and length of life? So to me, those are social injustice issues that healthcare has to begin to address. And, so the other sort of interesting thing is now we're being looked at as, okay, how are we, the Cleveland Clinic, or we, University Hospital, or we, Metro, going to deal with the food problem? Or the neonatal deaths? Well, neonatal deaths aren't caused by the fact we don't have good NICUs. They're caused by the fact that there's no prenatal care, that very young women are getting pregnant. And those are the issues that we really aren't equipped to deal with. So those are the social issues that your generation is going to have to deal with. We got great medicine in the United States. The whole world wants to come to the United States when they get sick because we got great care. But that great care, it's not that it's not given out to the public in a well-distributed sort of a fashion. It's the fact that we don't do all the other social things that need to be done.
So we're going to have to wind down here. We've met the witching hour, but the last real quick observation and question is you made a little announcement Monday.
Really?
Surprised no one asked it.
Yeah. It's been a tremendous run, and I like the way you phrased it about moving into the next phase of your career in many senses, and passing the baton for the position on, but going to stay on, hopefully as an intimate advisor to the system as well as a consultant. And I wanted to give you a chance to make one last comment about that decision.
Yeah, so let's put it in a perspective. I came here 43 years ago. It's just and I had a most satisfying career as a cardiac surgeon you can possibly hope for, way beyond my wildest dreams. And I never anticipated nor campaigned or thought about being a CEO. It was not in my vernacular at all. And when I was about ready to quit cardiac surgery because I was 64, and I know cardiac surgery is an athletic event, and I was going to leave the clinic, and I was thinking about going to California and going to the venture capital world and working on following that path. The CEO retired, and I got asked to throw my hat in the ring and got selected, and I had an incredible privilege of leading this organization for 13 years. And I spent a lot of time and concentration and effort in putting people in leadership positions so they'd have an opportunity to see if they liked it, see if they're good at it. I think leadership positions is about 90% experience and about 10% academics. We now have over 250 people, doctors, who are in some sort of leadership position. So I think my objective always was, and I started this from the first year I became CEO, is present to the board half a dozen people who I thought the potential successors. And over time they've continued to change, and they've gotten better, and there's gotten more of them that are qualified. And I thought it was time that I turned it over to somebody else. 3 questions that I get asked is, are you sick? No. Are you going to government? No. You have another job? No, I don't. And did you get fired? And none of those happened. So this is my decision, and I just think it's the right time for the organization that somebody else takes over and runs it and has the same sort of privilege that I have.
Well put, well stated, and I think I can speak for you when I say that he's going to have a soft spot for CCLCM for a very long time.
Absolutely.
So I want to thank Toby for being here and doing this, and it's time to go outside and enjoy one another.
Great.
But thank you so much, Toby.